Hello, Bhavna.
Hi, morning, Shiva.
Morning. It's such a pleasure to have you here. From your busy schedule, I know as a doctor, and especially in onco, you have so much going on, and you made the time for this, and I deeply appreciate it, Bhavna.
It's a pleasure to see you, actually.
So, welcome to Soul Brews and to Coffee and Soul, and I'm so excited about this conversation with you right now.
Thank you. Thank you. Thank you for having me. I mean, for me, it's like it would be a pleasure talking to you.
Lovely. I'm so happy to hear that. Bhavna, you have got your cup of coffee or
Yes,
tea?
I do.
Okay,
Coffee
lovely.
time.
Coffee time. All right, and I'm going to do is just pour myself a cuppa as well.
Brilliant. Brilliant.
I love the sound of this.
I know. So, so in London, every 11 a.m. was our coffee break. So
Right.
everybody would gravitate towards the coffee room.
Yeah, yeah,
So I
yeah.
just delayed it a little bit today. I thought I'll have my coffee with you.
Lovely. Cheers, and here's to
Cheers.
thank
Cheers.
you for all that you do, Dr. Bhavna.
Cheers.
Cheers. Let me have a sip. That first sip.
That's the other thing I learned it from Italians. So when
Okay.
after you say cheers, I used to, do this and keep my
Yeah,
toast down.
yeah,
Sometimes I didn't
yeah.
want to drink. They said, no, 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 you can't do that. You have to drink.
Drink it. Exactly. Exactly. Can I ask you to just hold your cup of tea in your hands
Yes, yes.
and close your eyes and sit back for a second? You can have both in both your palms. Just feel the warmth of this cup in your hands. And what's the visual that comes before your eyes as you sit back?
Mountains.
What else?
Thinking of Rani Khet, where we stayed. The mountains, the trees, and ground underneath.
What are you doing there?
So I love walking. So I think so happy memories of being in Ranikhet, walking, going across between mountains through the. They had so I mean just walking and
Lovely.
talking to my sisters, my dad, my mom, uh, and having picnics under trees, which we did often in Ranikhet.
Beautiful. Beautiful. Now, whenever you're ready, you can open your eyes. Whenever you're ready, you can open your eyes.
Wow, that was lovely. I wasn't expecting that.
What did that, you shared some already, but what did that mean to you? This little space that you went into and created right now.
So I think that's a very happy memory for me. It meant time with family, time with friends, enjoying having a picnic. The ground I think is to do with exercise. My dad was very disciplined about exercise.
Okay, okay.
So Somnath ground, I remember Nietzsche. It's a very important that you have a disciplined life.
Yes,
He was in the
yes,
army,
yes. Okay, all right,
so discipline included exercise,
right.
and, which is like an important part of everything that we do.
So are the mountains your go-to? Normally, if you were to relax, is that what you would do? Would you go to the mountains, Bhavna?
Yes, 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 absolutely. I mean, this year I miss it because last year also we went to Simla
Yeah,
and just take about 4 5 days off with the family, and that you come back completely energized,
yeah.
and the whole next 4 5 months are absolutely brilliant.
Bec-
And
because of that?
I think so. I think so. So I always gravitate towards the mountains. So I have a lot of friends, they love the beaches
Yes,
and the sea. I love that also. But for me, mountains hold a very special place. The hills, the
yes.
snow, and So I tried to learn skiing when I was in London. I was a total failure.
Really? But I think just the trying of itself must have been beautiful. Just
Yeah,
trying it
yeah.
out and experimenting with that must have been, yeah,
Yeah, I loved being on top of the mountain, of the
yeah,
snow,
yeah.
taking the the I can't remember what it's called, the
Ski lift?
ferry
The
kind of a
ski
thing,
lift?
which you
Yeah.
go up the mountain. Ski lift,
This
yes, yes, the
ski
ski
lift.
lift, yeah.
Yeah, yeah, yeah.
And I tried the beach slope, but then I couldn't. So I think I was in my late 40s when I tried.
Okay,
No,
okay.
no. So yes, early 40s. Yes, early 40s.
All right.
So I've had friends who've learned in 40s,
Yeah, yeah,
but
yeah.
it just was not for me. I think I was too scared of a fall and breaking a bone or something.
You've been so busy through these COVID times, and I don't want this to become a COVID conversation, right? Because I think we need to all move away, and particularly you as doctors and the kind of work that you do, some spaces away are so essential. But just so that we kind of keep that tick that off, what's it been like for you in this time?
I think it's been hard for all of us. To begin with, it was the fear, when everything started.
Mm,
So I sent all my family from Delhi to Meerut
mm,
because I thought, I was the biggest risk factor.
mm.
A healthcare worker is a risk factor. I keep telling patients as well, try and avoid visits to hospital if you can, but you must come if it's needed. So the first 3 months, didn't have any servants come in because you didn't want to expose them as well. So
Sure.
everything cleaning, everything, looking after oneself, looking after patients, going to hospital. So it was very hard, very hard. But I think now we've got used to it because we know that it is here to stay for till we don't know when. We just have to follow precautions. So mentally, I think we are much calmer and not so concerned because of course we are taking precautions, so
Yeah.
it's not so bad right now. March, April, May, the 3 months were quite tough
Very bad.
with
And
the
is it also because we find that, now we know how to deal with it? I mean, we have some things that could help. That would be,
absolutely. And with patients also we've said, come with one attendant,
yeah.
avoid, don't bring too many attendants with you, and we are trying to minimize the visits. We are doing video consultations.
Right, right, right.
That is the norm now, doing or tele or video consultations, which I think the most positive thing that has come out of COVID.
Sure.
Because I piloted it in London, I remember, but I had to jump through so many hoops to try and because the trust wouldn't get paid for the video consults. You
Right.
had to go through this collaborative, that collaborative, and now it's implemented everywhere.
Fabulous.
So they
Fabulous.
say data
Yeah.
protection, confidentiality, how will you maintain it? And now it's all done. So I think it's here to stay, and I don't think any of us will get rid of it.
I mean, it's a good thing. I think if there's going to be a bit of a balance between both things, that it'll be good all around, won't it, Dr.
Yeah.
Bhavna?
I mean, I can consult now patients in Kolkata, in Delhi, being in Chennai. So, which is great for patients. And plus, it saves so much time and money for patients.
Yeah, yeah,
Travel to see the doctor, so, some of our patients come every week as well.
yeah, yeah,
So, the parking, so, the stress level starts increasing right from there
yeah.
when they're trying to find a parking space,
Sure.
waiting in the queue, waiting in the lobby. So all of that is gone, I think. So it's good for everyone.
That's great. Bhavna, as I ask you to reflect on your life, and you've had quite an interesting journey, could you tell me a little bit about some of your highs, some of your defining moments, your key learnings? What took you on the path that you have traveled? And I'd love to hear more about that.
So wow, I didn't think. I thought we are going to talk about cancer prevention.
We can do that as well, but
No,
later.
no, 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 no. It's so I think I come from a very conservative family, where from a small town, Sirohi, and then Meerut, and so the norm was all girls, So I was trained to be married and to be a housewife. So, I learned stitching, sewing, knitting, making pickles, everything.
Mm.
So it's like, I was not allowed to cut hair. I had long hair till my thighs. It says, ladka pasand nahi karega, and all that kind of things.
Wow. Yeah.
So nobody worked in our family.
Mm.
No lady worked, I mean.
Mm.
Yeah.
Mm. Mm.
So I think that was the defining time. I was 13, I think, when I realized that I read this book called Fever. I always talk about it, Robin Cook, and I decided
Yeah.
I want to be a cancer specialist.
Is that it? That's the book that did it. Wow, really
So,
amazing.
the books have defined me always. So, I was a voracious reader. I would get under the bed and finish 2 novels in one night. And even when I was like 7, 8, I mean, I loved reading, always loved reading. And my father encouraged it a lot. So, he always ran out of books. So, he had to go and buy some.
Mm.
All my pocket money, 100 rupees, I would remember I would go and just buy books. All pocket money went into books. So I think they defined me in who I am today. And I decided I want to be a cancer specialist. And then we realized, oh, for cancer specialist, she has to become a doctor first. You don't become a cancer specialist just like that. Then I realized it's not just a doctor, you have to do post graduation. And at that time, the only place, I think my grandmother's father, Nani ji, had gone to Dr. Paymaster in Tata Hospital.
Okay.
She could talk about it.
Mm.
And so I thought, I have to get to Tata Hospital somehow.
Mm.
And then, the whole thing started about how I meet Dr. Advani. I found, to treat leukemias, I will need to be. So, that's how it all started. But the
Did the
thing,
family encourage you when you
no,
started doing this, or did you have a battle?
huge battle. And it was that the boy was, I still remember his name was selected, who I was supposed to marry.
Yes.
Turned 18, and then my father took me to all the cities to give the exams, AFMC, AIMS, and we would stay in these hotels and give the
Mm.
exams. So I got selected in most.
Mm. Mm.
And then my grandmother and my father, I think my Nani ji and my dad were the biggest supporters. And then it was like so it was always considered nice if you didn't pass an exam in a family as a girl.
Right. पढ़ के क्या करोगी?
And I would always, I think I learned this. Ayn Rand was my favorite author in those days. For me, excellence in everything was very important. I thought, mediocrity is something which I can't handle. I shouldn't. So I always came first. And in fact, my dad had to make me take part in races and singing competitions. So I came last. So he said, you should learn to lose also.
That is so amazing that he made you. He
Yeah,
kind
I
of
would
says
come second, I would be depressed. I would take him to the school and, make him talk to the teacher as to why my half mark was cut or. And, I was literally quite, so, but then, I think they supported me. And then my younger sister got married actually. And it was like, तुमसे कोई शादी नहीं करेगा, छोटी बहन की पहले हो गई शादी. And but anyway, so so I at least paved the way
yes.
for my other sisters as well, and to do things that they wanted to do and what they were passionate about. So now we have bakers in the family. We have
Yeah, I've had some cakes there. Those are lovely, lovely cakes. Yes.
this woman, and but most of them have got married at the age of 18, 19, but that has changed from the next generation, that is my nieces, nephews. We've always encouraged them to first of all, if they fall in love, find somebody if they want to get married, or at least complete their education, their graduation and post graduation, if at all possible. So I think it started with my cousins as well, who are much younger, who are like 14, 15 years younger. So the family has realized the importance of education after, I think, seeing me as well. I mean, after I got into medicine, everybody has supported me. So, my uncles would go to Nai Sadak to get my books, and so who, to begin with, were very keen that I get married. So they would go and get, so I would always have 3, 4 reference books at home. I love teaching as well. So I loved teaching my junior students as well. So I'd call them home and teach. And so I think being a doctor has made me follow my passion of becoming a cancer specialist, and also my passion for teaching and educating.
Yes.
So
Yes.
that has, I love doing that. I love, even now I do a Saturday evening class where I have, that's the other good thing with COVID. So, I had started it for 5 students when I was at Max Hospital. And then, we have about,
Max Delhi, when you were in Max
Max
Delhi.
Delhi, yeah.
Yeah.
So we have about 200 students from all over India on the
Right.
watch.
Right.
So surgeons, radiation oncologists, medical oncologists, they all join in whenever they can,
Wow.
depending on. So that is the other good thing, it has kind of, I feel, democratized education.
Yes. Yes. I know what you're saying. Yes.
Breast support group meetings I do third Monday of the month. Again, we have patients from Tanzania, from Africa, from India, all over, from
It's
London.
amazing. Yeah.
So, these are the 3 great things that post-COVID, it's, I don't know why we didn't do this before.
Yeah. Maybe it took a crisis like this to accelerate some of the things that had to happen.
Yeah. So,
And you jumped on it so beautifully.
yes, absolutely. So, I
Yeah.
mean, these are the 3 great things I can think about post-COVID. And as far as my life is concerned, I turned 50 a couple of years ago, and we were sitting and reminiscing with some of my childhood friends. And I was saying that, I have actually ticked, as a child, you have a lot of dreams. I want
Yes.
to go to, I used to read Wordsworth, daffodils, and all those things.
Mm, mm.
I wanted to see a daffodil. We'd never seen one in India.
Right.
I wanted to see these Yorkshire, fields, and so you have these things. You want to see the Sistine Chapel. You want to whatever you read in these novels.
Yes. Yes.
So Colosseum, a lot of things you had in your mind which were like dreams. So I felt that I have ticked every box.
That's amazing.
So
So far, whatever you wanted to do, you have gone ahead and done it while achieving great things that you do in the medical world.
even like I read about WHO, IAEA. They do such great things. I gave a lecture in IAEA in Vienna.
Right.
It was translated into 100 languages or whatever. They had these phones and all. So that I had seen on TVs, and I always imagined myself standing there. So I thought you have to be prime minister to or a president to do that.
No, I think you just have to be Dr. Bhawna Sirohi.
No, and I just did that. I was invited, and I was shocked that actually I was
Amazing.
not
I'm
invited.
so
My
impressed.
mentor was invited.
You're what? Sorry?
My mentor was invited to
Okay.
take
Okay.
over, and he
Yeah.
couldn't go.
Yeah. Yeah.
So he said he used to call me Bhavs. Says, Bhavs, do you mind going there to Vienna? And I didn't realize it was to IAEA.
Amazing.
I went there and all these flags and oh god! So I'm part of this nuclear accident committee for Europe.
Right.
As
Right.
part of that, we are part of WHO, IAEA. So I think everything I had dreamt of, thought of, that I wanted to do, some amazing things I've done over the years. Wimbledon, I wanted to see. I used to watch late night, watch Boris Becker, John McEnroe, Chris
Yeah.
Lloyd, Martina, play at like 3 a.m. with my dad. I used to sit and watch. I used to watch football, World Cup. So I've been to at least 7 finals in Wimbledon, center court, and same.
Amazing. Amazing, Bhavna. It's such a delight.
I
Okay.
watched cricket at Lords, at Oval, and I mean, so there are a lot of things which we dreamt as a child.
Yeah. Yeah.
So all those boxes were ticked. And then I thought that I have to create now new dreams.
Yeah. Right. Right. And what were they?
So again, now I'm passionate about trying to deliver quality care in India. So that's my one track mind.
Is it like, all the external things that you wanted to achieve, wanted to go see, experience, feel, do, that is pretty much done. You've done everything. And now there's a single focus. What I'm hearing you say is to
Yes.
focus. Is that how it's evolving, Bhavna?
And also, quality care. So one problem I've always had all my life, and my
Yeah.
father always tried to say, so again, this is from Ayn Rand. So
Yes.
it's either right or wrong. There's nothing in the middle.
Yeah, that's how I understand for you. Absolutely. Yes.
Anything in the middle is evil, he used to say. So for me, everything is very black and white.
Hmm.
Either it's right or wrong. My father used to keep saying, don't be such an idealist, because you end up being disappointed a lot of times if you are. But I haven't changed at all, and so I can't look the other way. So even if something is not right, I try and set it right there and then. So I feel that within my space, I try to do that as much as possible every single day.
Mm.
And that sometimes means huge battles with the management, but it's always patient is at the heart of it.
Of course.
And
And that defines you from whatever I've experienced and my family has experienced of you,
so
Bhavna.
it's like, Shivan, it's like, I feel work is worship, and I truly mean that.
Yes.
So for me, I haven't gone to any dhams but I feel every day when I come. So I think somebody said that if you love what you do, I don't know who quoted it. If you get to do what you really want to do in life, then you'll never work a single day.
Yeah. Yeah,
I don't know who
exactly.
said it, but somebody said it. It's not my quote.
I can't remember who said it also,
Yeah,
but
but
yes,
I
very
feel
much
I'm
so.
not working ever. I
Mm.
feel like every morning I'm excited to come in. It's a new day. It's a new, every time a new patient walks in through the door. I mean, your dad, I mean, when he walked in, it's like, you enter into their domain, and you put so much trust, and that, that you allow the physician to be part of your family, friend. And I feel that with every patient walking in through the door. And I still enjoy it. I mean, I know the day I stop enjoying it or not wanting to, I'll probably retire. But I don't see that ever happening, because it's something which is unique, that
Exactly.
we have as cancer specialists.
As cancer specialist. And Bhavna, I think you're blessed. And not only are you blessed, you also blessed by your sheer dedication. I mean, it would be I would be completely remiss if I did not recognize the huge, huge contribution you made to my family. My father, my mother, my brother, my sister, all of us, by the way that you took care of my father right to his last day. And I mean, if there's anybody who I feel I would say that if you have this condition, if there's anyone you need to go to, you need to go to her, because it's not just her speciality, it's the human being that she is, That
So,
is what is so amazing.
Shiva. But I think I feel, like I said, it's a privilege.
Yeah.
And to hold a patient's hand right from diagnosis till end of life, or till cure, or till, in some patients the cancer comes back. That's the most distressing time that they go through. And I mean, I still lie awake sometimes, so it's a human thing. You get attached to some patients
Of
more than
course.
others.
Of course.
And I stress a lot about scans sometimes. I keep thinking and praying, I hope the scan is good. It's so I recently had a 32-year-old colon cancer patient. Actually, he's in Delhi. Lovely, lovely man. And some platelets had gone down slightly,
Mm.
marker was up. And I was so stressed about the scan. I said, I'm in Chennai. How will I help, if the scan is not good? So thankfully the scan was fine. So, it's still, and it's something which really, really, I thought, with age and experience, I'll get better at it.
No, but it's who you are.
And or in ICU, when you have a talk about some difficult conversations with patients, sometimes it's still very hard.
Yes.
And it's hard for the doctor, it's hard for the family, of course.
Yes.
Very,
Yes.
very hard.
How does how working with cancer so closely, such a debilitating disease, how do you retain your sanity? What do you live by, Bhavna, that gets you through?
So I think I am very lucky and blessed to have an amazing family
Mm,
and friends.
mm,
So and first of all, I always say that, a happy doctor is a happy patient.
Right. Right.
So I try and look after my mental and physical health. I read books still. I try and read 2, 3 books a week still. And so I need about 4 hours sleep. So
Is that it? You live with 4 hours sleep? Okay. You never cease to amaze me.
So I love reading. I love writing papers, learning from patients, analyzing everything that I do, every patient I treat, and keeping physically fit.
Yeah.
You know what I said, the discipline.
Yeah.
So I have a trainer 3 times a week. I try and do yoga, and my sisters are here with me currently. So I put on weight recently because of COVID, I think.
Yeah.
That's the downside, because you're sitting in front of
Yes.
Zoom meetings, lectures so much.
Yeah.
And plus, you're not climbing stairs in the hospital, which I used to do with the mask and the shield, and it's very hard.
Right. Right.
So I think I try and for me, it's very important I look after myself. Then
Yes.
only I can look after others. So I try and keep fit physically, and there are times where I also take psychological support as well
Of
sometimes,
course.
because sometimes you do feel down, especially in UK. It was a very good system. When I was a resident, I remember I never used to go to these lunch meetings with a psychologist.
Right. Right.
It's an Indian way of thinking. I think I'm not mad. It's that's how I was.
All right. Yes. It's true. That's how we've been conditioned.
Like that. Even I was like that. I would never go. And then one of my mentors called me. He says, "Bhavs, you never." I got this feedback that you never go to these lunch meetings. I said, I don't need it. I have amazing friends. I have amazing family. I talk to them every day. And you guys, you have no family support. You have no backbone. So you guys need it, I said. I was very disdainful that,
Yes.
that Indians, most of us have amazing family support.
Right. Right.
But then I went to one of the meetings and I realized that it's so important. You asked me about reflecting. So in the Royal College of Physicians has a thing where we have to write down and we have to reflect on everything we do every year.
Yeah.
And that's how, I think, and what I did in those meetings was, reflect on the week.
Right. Right.
And, each patient affects us in a different way. And you said, in cancer, it can be exhilarating. I see a patient walk in with a smile who came on a stretcher one day.
Yeah.
So that's like amazing.
Yeah. Yeah.
And you can have a very difficult conversation with another patient. So every day is different. Every week is different.
Yeah.
And, what I did was I learned from my colleagues when we sat down and talked about it.
Yes.
We had something called Schwartz rounds, where we would all sit together as a team, and I would learn from my transplant colleagues.
Right. Right. Right.
They also have difficulty in trying to convince a patient to donate organs when they're going through so much hell. And so you learn from each other. So I realized that psychological support is important for everyone.
Yeah. Yeah.
So I changed the way I think. And I started going to that, and the NHS, was amazing. I wish we had universal health coverage in India as well.
Yeah. Yeah. Yeah.
So I think it's important we look after our physical health, mental health, and I try and do that proactively.
So you take support whenever you need it, wherever you have a good source, a support system, whether it's through psychological support in the family, or if you need to talk to someone, you just go ahead and do it. And you do your own practice in terms of yoga, meditation, as well.
And reflect on what you've done actually.
And reflection.
Every week.
Yes. Yes. Yes.
It's very important what I could have done better, what I could have done different. Personally, with a relationship also, let's say, with my sister, my mother, or even, your friends. So I think that's reflection is something which I have learned.
Yeah, absolutely. It's such a powerful tool, particularly, and maybe we in coaching use a lot of this called journaling. It's this.
So I journal as well.
So you journal as well, yes.
He gave me something called the 5-minute journal.
Okay. Okay.
Part of it.
Okay.
before I go to bed and I get up in the morning,
Yes.
I
Yes.
write down things I'm grateful for.
Right. Right.
And at the end of the day, I write down things I could have done better
Yes.
today,
Yes.
on the day. So I'm not very, some days, I'm very exhausted and tired. So I
Sure.
forget.
Yes.
So, but then I try and do it the next day. But this is something, in London when I would do it every day.
Yeah.
But here, I think it's in India, we don't have systems and processes in place.
Yes.
So it's not like I can switch off at 5 p.m. or like
Mm.
I did in London, or, on a Friday afternoon, switch off and then, you are ready for work on Monday morning.
Correct.
Here as doctors, I think in the corporate world, the systems and the processes are not need to be put in place so that they are as robust as the West. But again, that will only happen if we have universal health coverage.
Mm.
I think as citizens, we all should fight for with the government.
Yeah, I think there should be a lot more awareness around it also, Bhavna, because I don't know if people are really even thinking like
Yeah.
that. Now your focus is on quality, right? That's what you focus on, quality health. Is that?
Quality health in every sector,
Yes,
the
yes,
delivery of chemotherapy, and patients shouldn't have to wait when they come in, right
right.
from the time they enter the hospital.
Mm.
The appointments are there at a particular time. So delivering quality in everything that we do, and also something which is at par with international standards,
Yes.
irrespective of the economic or the social uh, position of the patient.
Mm. Mm.
Every patient should get the best that is available under the sun today.
Absolutely. And there's no reason not to, right?
There's no reason not to. So we
Yes.
try and do that. We try and help through charity, through funding, and
Mm.
other things. But it's difficult. It's hard in India to do that. But I think we should still make an effort.
Yeah. The question that I want to ask you now, Bhavna, is there a metaphor of life that you have or an adage that you live by? Is there something, there could be many, but is there one or two that, it's like your fallback?
So I think doing integrity in everything you do is very important.
Mm.
So if I feel that's my motto, that it's uh, that whatever you do it with integrity, and and the second thing is discipline
Yeah.
in life,
Yeah.
because all of us have ups and downs, various stresses in life. But it's very important to be, because, and the other thing for me very important is compartmentalizing,
So bracketing things.
bracketing, because I'll have a patient who or something may have happened at home. All of us have
Mm.
tragedies that happen in our lives.
Of course.
Very important that I walk in. So I lost my father, and I had to go 2 days later and see a patient. It's very important that you don't transfer that. So it's very important. I learned early on that compartmentalizing as a cancer specialist is the most important thing. So I may give a very break bad news in one for one patient, but the next patient who's walking in through the door has had an amazing scan.
Mm.
So it's very important that the home thing doesn't come into work, and the work thing doesn't go into home. But work thing, I think, sometimes does go into
Go to
home.
home.
I still haven't got around that.
Sure. How
So
much how much emotional and mental maturity this takes, Bhavna, to do this? I mean, the reach of, as I'm hearing you say, the reach of the human mind and the heart has to be so huge in order to accommodate this, for every person be 100% present to what is their reality. I think that is amazing.
it's quite hard. It's quite
Yes, yes, yes.
I mean, I've had periods, when you've seen like 7, 8 new patients in a row.
Oh God,
And
yes.
then, sometimes one patient can take 1.5 hours or even
Mm.
2 hours the first time. It's
Yeah,
for me, it's very important that I focus on what's there, and then so once I remember in the NHS, I was doing a clinic, and at 9 p.m., which is very rare, it never happens.
mm.
The patient had a 4 o'clock appointment, and
Wow.
so it's hard. It's very
Yeah.
very.
Yeah.
But then, you automatically, as a human being, start becoming short with your answers,
Right.
start
Right.
getting irritable.
Yes.
And I think with time, I have become better at it.
Mm,
I was not so good, I would say, in my younger, maybe even 2 decades ago, 1 decade ago.
mm,
I
mm,
think
mm.
with the years gone by and with experience, I used to. So now the other thing I've learned is you don't fight all the battles sometimes. Sometimes
Yes.
you choose your battles.
Correct.
So if there are 10 issues, I prioritize now, which is the most important.
Yes. Yes.
That
Yes.
also come with time, that what you prioritize. And so I think the maturity has got better with time. I
Mm, mm.
still have lots to learn and do, I'm sure.
Yeah. Yeah, but even so, whatever you're sharing right now is so powerful, Bhavna, in terms of a human being's journey, particularly on the line that you have chosen.
Yes.
Is there anything you feel you could have done differently in life?
So I think I probably not. Probably,
Mm.
yeah. But the only thing is, I went back. So I've done this. I came back to India in 2009 and then stayed for 5, 6 years, and then went back.
Went
Um,
back to UK?
went back to London because I,
Mm.
it's impossible to work here.
Yeah.
So there are some things, you. So I think that was the only thing I can think of, maybe. But I
Mm.
think it was very good. I went back because I learned so many things,
Yes.
and I
Yes.
went back, which I would have denied myself. A lot of new things, new technologies have come up. So I feel that maybe I should go back every 2, 3 years for a couple of weeks rather than 3 years that I went back for.
Right. Right.
And because there are some things which you need hands-on experience with rather
Correct.
than being in your own world.
Yes.
So maybe that, but other than that, I don't think I would have done anything differently. Like I said, I have always decided what I wanted to do and always gone for it, and without any hesitation, and always enjoyed what I'm doing. The minute I stop enjoying, I change the situation.
Yeah, I see that. I see that completely about you, and that is so amazing because you're so much in the driver's seat,
Yeah,
and I think also it happens because it's there's so much clarity. There's
yeah.
just so much clarity, and so you don't get dissuaded or what I'm hearing you say is also, and you don't lose focus.
No,
And
that's very important.
yeah,
Not to lose focus. The patient has to be right at the heart of what you're doing, for me.
yes,
And whatever I do, like putting systems, some processes in place so that everything is safe for
yes,
the patients and also is effective.
yeah,
And so I tell all my junior doctors as well, don't become a cancer specialist unless you're very passionate about it, and because it's not a 9 to 5 thing.
yes,
It's something which has to be a vocation, that you really want to do something. And I'm working with some amazing colleagues, and
sure,
amazing colleagues here in India, abroad as well. At the heart of most of these healthcare systems is improvement of patients' care, but I think there are some places which are losing focus,
sure, sure,
in where it's especially the revenue-driven models,
yeah.
and I think that needs some regulatory thing from the
Mm,
government, which
mm.
hopefully make it better.
Mm, I hope so. I hope so because that is a bane for so many people, and
Yes.
even practitioners like you. I mean, and as well as the patients. I mean, it's. Um, so cancer prevention, as you said, what is your message for younger younger people, our age group, people older, men, women? What can one do in order to prevent this? Is it genetic, or is it possibly the environment, the pollution? What is it? What do you think we should do?
So I think genetic is less than 5% of cancers.
Mm,
And I think what we should do is listen to our body. That's the most important message. If you feel that things have changed, you've got anything that's out of ordinary, like you have a lump or anything that's new,
Mm-hmm.
cough that's not getting better, take medical advice. I think that's the most important thing. And so I had a lady I saw at a party. She had a lump here, which was painless, and not realizing that she had breast cancer, which had gone to the lymph node. So again, anything unusual, even if it's painless, don't ignore.
Right.
And the rest, I think we can prevent half the cancers just by, avoiding tobacco, alcohol, and have your screening tests done at your appropriate ages. Have a mammogram when you've turned 50
Yes.
every second year. These are things which have shown that it works to have screening done.
Correct.
Have a stool occult blood test every year, once a year. Colon cancer is rising in the metros in India. So cervical cancer, again, every 3 years you need to have a pap smear.
Right.
You
Right.
have a maid servant or even your own children or grandchildren, give them the cervical cancer vaccine, the HPV
Mm.
vaccine, which is only 2 doses,
Right.
not
Right.
so much. And in UK, all the boys and girls get it in schools,
Right.
age
Right.
of 10 to 23, before sexual exposure.
Right.
And cervical cancer is common in India. So these are the various things one can do. And again, discipline in life, calm, yoga, meditation, exercise, balanced diet.
Yeah.
It's
Yeah.
not just for cancer, for diabetes, blood pressure,
Anything. Yeah. Yeah.
all of these. It's very important. Yeah.
Yeah. No, thank you. And I think there are some gems in what you have said, and we need to be aware of that. Bhavna, your unique legacy. Each one of us has a very unique take on life and a unique way that nobody else. There's nobody else who's Dr. Bhavna Sirohi here in this world. What do you think is the unique thing that you add to humankind? What do you bring?
So, so I feel that I'm not able. I don't think I can change everything in a day, and I can't change. Every single day I try to change things, and every single week I try and get in something for quality improvement. But I think it's important for all of us that we do not look the other way. If you see something that's wrong, speak about it, say something about it. For me, women's equality, coming from my background, is very, very important. I hear this a lot. Oh, she's not very experienced, she can't speak well, even when I'm doing small meetings. So I try and bring my fellow women up as well. We've set up a for oncology group as well, because I think some of us, will go take some time off to have children, will
Mm,
have a focus on the family.
mm,
So that is taken as as something which is negative. So
mm,
I feel that don't look the other way. Just whatever is there in you have a maid servant, you have a driver, you have your own family around you. Try and uplift everybody. Try and do something which will be good for their health, good for their education. Like I had a driver, I made him do 12th and his graduation. Because
wow. Yeah.
he spent from 8 a.m. to 6 p.m. He was just sitting in the lawn doing nothing.
Right. Right.
So I
Right.
said, why don't you do your 12th? And now he's employing 3 people in Uttarakhand.
Amazing.
So
Yeah.
it's
Yeah.
very important that you uplift every single person around you, whether whoever it is. I think that's my motto in life.
It's, you're really, what comes to my mind as you talk about it is that starfish on the beach, that story. That this the the story, right?
Yes, yes,
Yeah.
yes.
And it makes a difference to this one, even if, so I think that is
Absolutely.
beautiful. That is beautiful.
Yes.
um uh, you know for this lovely conversation. Thank you so much for making the time. Is there anything else you'd like to say before we close out? Any message for, as I said, the younger ones or people who are just starting out in the career that you have chosen?
So
Anything?
I mean, Shiva, thank you for having me. It's been such a pleasure talking to you. So this hour, like it's brilliant, and I think the only message is be kind, be polite, be disciplined, uh, and have integrity. I think, and have a social antenna.
Yes.
Try and do something out of your comfort zone. Try and do something. So I think if we all do all these things, so these are most of the things that my father used to say.
Yeah. He's a big part. He's a big influence in your life, isn't he? Yeah.
Yeah, definitely,
Yeah.
definitely.
Yeah. No, thank you so much for your time. And it's been an absolute delight. Every time I engage with you is an absolute pleasure. But now having this conversation, I think it opens different facets. And I'm so happy to have had the Soul Brew with you. And I wish you all the very best as you go ahead in trying to change our quality in medicine. And I'm sure, given the way that you work with things, that it's going to be a huge success as well.
Thank you so much, Shiba. Thank you for having me.
Thank you so much, and you
Pleasure
take
talking.
care.
You
We'll
too.
talk, we'll talk soon. Thank you very
Give my
much.
love to your mom, please.
I will do that. I will do that. Bye.